So hi, this is Dr. Rita Marie Lascalzo, and I'm back again with more on vitamin D. And today what I want to talk about in relation to vitamin D is how do you determine what the right dose is. We talked on the previous video about vitamin D and how it's important and how you need to test and the kinds of things that can happen to you if you don't have enough. So let's talk about how, once you get your test results back, how do you know how much to take? And I want to preface this with, I am not diagnosing you. I am not telling you how to treat yourself. I'm just offering you suggestions of what I've done with people. And if you get a test result back and it's low and you have any questions at all, check with your doctor to make sure that your doctor is, he or she is approved what you're doing. So I just want to make sure that that's clear. So when I get a vitamin D test back, the range that the lab talks about, which is, I think usually they say anywhere from 25 to 55 is a normal range. First of all, let's debunk the whole idea of lab ranges and how normal they are. Lab ranges are not normal. Lab ranges are not optimal. Lab ranges are average. They calculate them for the average of all the people that show up at the lab over this course of time, and then they go 2 standard deviations off the midline, and that's what they consider normal. Well, I don't know about you, but I don't want to be 2 standard deviations off the midline of a normal population. That's really a sick population. 50% of people almost get cancer, heart disease is on the rise, diabetes is on the rise, and that's say nothing of all the chronic fatigue and all the debilitating functional things. The deadly stuff is on the rise. So I don't want to be considered normal in relationship to that population. Do you? I mean, not really. So what I recommend is that, first of all, researchers in functional medicine and natural healing come up with ranges that are much tighter and are much more suited to what's really happening in the optimal population. What they've found with vitamin D is that the closer you get to 100 units in your blood versus the 25 that they're saying might be normal, the closer you get to 100, the lower your incidence of cancer. And cancer practically disappears in people whose vitamin Ds are 100 or more. So, and especially female cancers, so uterine cancer and breast cancer. So if you want to protect yourself from cancer, a good idea to keep your vitamin D levels in an optimal range. I target to get people up at least about 60, 75. So when somebody gets a lab result back, you look at your lab result. I have had people that are as low as 6, and we want them at 100. And I've had people who over supplemented and ended up with 200, and that's not good either. You can get side effects, which we won't go into on this video, but you can get side effects for having too much as well. So what I recommend is you look at that number and just kind of my way of approaching it. And of course I take into consideration some of the other things that are going on with the person, some of their health history and all. But what I'll do is if it's under 20, I will have them take 20,000 units of vitamin D for a month. And I won't go past a month unless they're willing to test again at the end of the month. Ideally, I'd want them to go back and test at the end of the month, see what the 20,000 did, if it took them too high or if it's not enough, and then we decide what to do for the next month. Most people don't have the funds that they want to spend the $50 a month to get their vitamin D tested, so they just say, well, can I wait 2 or 3 months? Sure. But what I want you to do is do the 20,000 for a month and then 10,000 for 2 months. Okay. Now this isn't for everybody, this is just what's worked with my patients. And what I've seen in some people, after 3 months of doing that, they're only up in the 20s or 30s, and I want to get them higher. So then I feel like, okay, it's comfortable, it's safe to keep going with those higher amounts, and we do. Now, if you're in that range from 20 to 30, I'll usually have people start with about 10,000 a month just to be safe. And if they're willing to do 10,000 for a month and retest and it hasn't budgeted that much and it's still low, then I'll feel comfortable going with 20,000 for a month. And this is a daily dose, not a weekly dose. People ask me that all, do you mean a weekly dose or a daily dose? No, I mean a daily dose. But here's the deal. If somebody gets that test run and they have like a 14 on their vitamin D and they start doing the 20,000 a day, for a month, and they don't get tested, and they do it for 2 months, and they do it for 3 months, you run the risk of excess and having problems. So it's really important, once you start dosing yourself with higher levels of vitamin D, that what you do is you continue to test. Okay? So if it's between 20 and 30, I might start them with 10,000. I might start them with 15. Just depends on how close it is to 20 or 30. Once it's in the 30s, anywhere from 8 to 10,000, I'll start them with. And again, it's always retest at 3 months. Right? And then if it's in the 40s or 50s, and I want to get it a little bit higher, I may have them do 5 to 8,000 to just bump it up. And if it's in the 75 to 100 range, I'll say, are you taking any right now? Whatever you're taking right now, let's maintain it. If they're not taking any right now and it's summer, I tell them maintain the amount of sunshine you've been getting. If it's winter, then and it's early winter, I say, well, some of that might be because you've had sun exposure over the winter. So I'd recommend that go a month into winter without supplementing at all, test again. If you're maintaining it through the heart of winter with the amount of exercise outdoors or the outside activity you get, then fine, you're great. You're the lucky one. But if not, you may need to have just a little bit of a dose, and it may be 1,000 to 2,000, small dose, just to get you through the winter. So that's my spiel. That's how I work with my patients. I'm not saying that that's what you should go out and do, but take it with a grain of salt, think about it, and make sure you get tested. And I'd love you to join our program, which is starting soon. But we have a program where we're going to help you to be able to read your own labs and help to know where you should start and how to know when to retest. So I'm excited about that, and I'd love to have you join me with that program.